What is the C. difficile risk with diverticulitis Roman 4 antibiotics? When it comes to treating diverticulitis flare-ups with intravenous antibiotics, a question often arises. What is the risk of developing a Clostridioides difficile infection? C. difficile is a bacterium that can lead to colitis, which can range from mild diarrhea to severe inflammation of the colon. This infection is particularly concerning after antibiotic use because antibiotics can disrupt the normal balance of gut bacteria. When intravenous antibiotics, especially broad-spectrum ones, are used, they can disturb this balance. This disruption decreases the natural defenses in the gut that usually prevent C. difficile from overgrowing. As a result, C. difficile can multiply and produce toxins that harm the colon lining, leading to infection. Certain factors can increase the risk of C. difficile infection during treatment for diverticulitis. Broad-spectrum antibiotics, like ciprofloxacin and metronidazole, are commonly used for this condition. While these antibiotics are effective, they also raise the risk of C. difficile infection. Clindamycin, although not typically used for diverticulitis, is known to carry a higher risk among antibiotics in general. Other risk factors include prolonged hospitalization, older age, and underlying health issues such as immune suppression or chronic kidney disease. Patients receiving intravenous antibiotics for diverticulitis may already have a compromised immune system due to the severity of their infection, which can further increase their susceptibility to C. difficile. Research indicates that the risk of C. difficile infection is lower with intravenous antibiotics alone compared to when oral antibiotics are also used. One study found that the infection rate was about 2.6% for those receiving only intravenous antibiotics, compared to 7.4% for those on a combination of oral and intravenous antibiotics. While the risk of C. difficile infection is significant, it is not extremely high during intravenous antibiotic treatment for diverticulitis. However, if patients experience worsening symptoms or new signs of colitis during treatment, it is essential to evaluate for C. difficile infection. Healthcare providers managing diverticulitis with intravenous antibiotics should keep a close eye on patients for any signs of C. difficile infection, especially if diarrhea occurs during or shortly after treatment. Diagnosis is typically confirmed through stool tests that check for C. difficile toxins. Treatment may vary based on severity, ranging from stopping the antibiotic causing the issue and monitoring closely in mild cases to specific antibiotic therapy for C. difficile and more severe instances. It is important to note that having diverticulosis does not seem to increase the likelihood of C. difficile infection relapse. However, factors like immune status and other health conditions do play a role. To minimize the risk of C. difficile during diverticulitis treatment, careful use of antibiotics, good infection control practices, and vigilant monitoring are crucial. In summary, while there is a risk of C. difficile infection with intravenous antibiotics used for diverticulitis, this risk is generally lower than with combined oral and intravenous regimens. The risk is influenced by the type of antibiotic used, patient-specific factors, and the overall clinical context. Being aware of the signs of C. difficile infection and recognizing them early is key to managing this risk effectively. Always consult healthcare professionals for personalized medical advice tailored to individual circumstances.